Continuing the discussion now on COVID-19 and the importance of staying informed, especially with the Delta variant. We're once again joined by Trinity Health of New England's Dr. Syed Hussain to talk about where we stand right now and all the pressing questions. Dr. Hussain, good morning. How are you today?
Morning. I'm great, thank you.
Yeah, glad to have you here. Curious to get your thoughts. As we just said, we're getting sort of conflicting indicators. The positivity rate has trended down for 4 straight days. Hospitalizations have trended down. Deaths are still going up. So what do you make of this? Do you think that the Delta wave has peaked or is in the process of peaking?
So a couple things. So this is a trend in the right direction for sure. The only reason why I'm a little hesitant to say, yes, we're clearly out of the woods right now is because schools are reopening, and it remains to be seen the impact that schools will have on the transmission of the virus. And also, if you look at it nationwide, Tim, the 7-day average continues to go up. It's not going up as quickly as it was earlier. It's around 150 to 155,000 cases a day. So that needs to also head in the trend in the right direction downwards before we can say, yes, we're done with this 4th wave, which is fueled by the Delta variant.
Okay, so outside of looking ahead, just based on where we are right now, that even if it's going up, we're seeing that flattening in Connecticut and nationwide. What are your thoughts about the level at which it's flattened out? It looks like it's not quite as high, at least in Connecticut, as it was in April. Definitely not as high as it was in January. Is that at all surprising to you?
It's not. And the reason why it's not surprising in terms of number of cases that we've seen in Connecticut and in this region is because of the high number of folks that have rolled up their sleeves and gotten vaccinated. That's the biggest key to success and to keep this virus at bay and frankly speaking, the Delta variant at bay. So we need to get to higher numbers in terms of vaccination. But that's the biggest reason why we haven't seen what Florida or Missouri or other states in the Southeast are experiencing.
I remember back, before the Delta variant came along, it looked like we thought the world, or at least the United States as a whole, might be in the clear. And then the Delta variant came and changed the whole dynamic. And now this virus may be around in some form forever. But after the Delta wave passes, whenever it does, do you think we might be able to at least get back to normal for as long as it takes for another more contagious variant to pop up, which could be months, could be years for all we know?
Absolutely. So I do feel optimistic that we will be able to return to some semblance of normalcy, as long as there's no new mutation in this virus. And that's why I've kept saying repeatedly that folks that have yet to get the vaccine, please get vaccinated, because the solution is in our hands. We need to get as many people vaccinated so the virus doesn't continue to mutate. The worst thing that can happen is the virus continues to mutate and a variant pops up that's able to evade vaccine protection. So as long as that doesn't happen, I am confident, given how effective and safe these vaccines have been, that we will be able to return to some semblance of normalcy.
I wanted to ask about the Delta variant, that it just seemed to take over the entire world and crowd out a lot of the other variants, which I understand just in terms of proportion because it's so much more contagious. It can reproduce much more quickly. But what about these other variants? Are they still there? Are they still spreading at the same rate? And I ask that because it looks like there are still plenty of potential people that are still waiting to be infected. In other words, there's a lot of fuel for these fires for all the variants. What has happened to the other ones? Is the Delta variant stopping them from proliferating?
So basically, the Delta variant is a big bully for this virus, and it's bullied out all the other variants and now takes center stage. And most of the infections we see here in North America are because of the Delta variant. Now, that's not the case everywhere, though. We have instances in other countries, in South America, for instance, where there are other variants that are slightly more dominant than the Delta variant. But for all intents and purposes, for Europe and North America, for parts of Asia, such as India, the Delta variant is the dominant strain and has drowned out all the other variants.
Okay, Dr. Syed Hussain, thank you so much for taking the time to tell us where we are and where we might be headed in the months to come. Of course, there are no concrete answers looking into the future, but we do appreciate your insight. And we'll look forward to talking to you again next Friday.
Thank you very much.
Thank you.